Hi, I'd like to talk to you about perimenopause. Let me ask, how prepared are you for perimenopause? And have you talked to anyone besides your girlfriends? I know for me, years ago, it was a pretty difficult time of life with very little guidance. I find today that there's still so much misinformation and that many come into my office uninformed. So I'm here to help you understand perimenopause. So oftentimes I hear, when does it start? Well, it can start in your late 40s, it can start in your late 30s or mid 30s. But what happens is that your level of estrogen during this time, the main female hormone, rises and falls. It can reach a level of 600 and then it can just come crashing down. And so during this time, you feel like you're bat crazy. You're not. It's just perimenopause. Symptoms that you may experience: irregular periods. They can be shortened, they can go longer, they can spot, they can disappear only to come back and you're like, whoa. Short-term memory problems, sleep becomes unpredictable, sleepless nights, mood changes, anxiety, depression, anger. You don't want to be next to anyone. Libido changes during this time. Your sexual arousal and desire may change. Also during this time, you may have urinary infections or vaginal infections due to the low estrogen levels. Painful intercourse due to the loss of lubrication and elasticity. You may also have issues with urinary incontinence due to the loss of tissue tone. Fertility: since ovulation becomes irregular during this time, your ability to conceive decreases. However, don't be fooled, because one day you may ovulate and then you're pregnant. So birth control, important, which we'll talk about. Lipid levels, they can increase, and then due to the declining estrogen levels. So during this time, important to really watch diet and lifestyle. So you may ask, how long can this madness last? Well, it can last a few months, 4 years, 10 years. For me, I felt like a long, long time. When you're finally done, it's without a period for 12 months. So as you try to educate yourself out here, be warned, there is so much misinformation, and that includes from various medical sources in which you're supposed to trust, right? Well, what I will say, there are some really good sources, but then there are other ones that are just not. So now I'm going to read from a medical page on the internet that many women will refer to. I won't give you the site, but many women will refer. It's rubbish and it's not backed by data. So one of the things that they recommend is antidepressants for anxiety and depression. You know what? Progesterone, micronized progesterone helps with that. Birth control pills, I'm not a fan of it. As a woman ages, take a look at those drug pamphlets out there. Blood clots, heart attacks, strokes, cancer, diabetes, blood pressure issues. Estrogen therapy, absolutely not at this time. Your tank is already full most days, and then you're going to add in more. Now you've increased your risk of endometrial cancer. Gabapentin for hot flashes. Really, progesterone is great and it's natural. We've had it our whole life in our body. Vaginal cream to help with vaginal dryness, but so will testosterone and progesterone. Hormone therapy, they warn, can cause stroke. Well, let's get talking about the birth control pills. The hormone therapy is safe. It's absolutely safe. Progesterone will protect also uterine cancer, breast cancer. Heart attack, they warn of. Well, hormones actually are cardiovascular protective, unlike the birth control pills. Blood clots. There's nothing in the literature with progesterone or testosterone with blood clots. Lastly, they advise you that if you're having difficulty with sex, that your provider can recommend you to a therapist. What? How about a little testosterone and progesterone? So all of these things do occur during perimenopause, okay? And it is normal. The good thing is that there is help. Bottom line, it's important to find a provider who's been trained in hormones. It can be a very confusing time, as I just demonstrated the junk you may find on the internet. So I hope this has been educational for you. Check out my website, www.rejuvenatemyhormones.com, or give me a call if you'd like a consult, 480-589-3999. And cheers to rejuvenating your hormones and wellness and getting through perimenopause, and you'll be just fine.